I think an online system for mental health services would be awesome. If it was me, I would want to look for information and services on my own and in my own time. As I see it, a system like this puts me in control of my health care and lets me see who I want when I want.
Through collaborative partnerships, the Young and Well Cooperative Research Centre has recently developed a prototype demonstrating a new and innovative online health system which aims to help young people manage their own mental health and well-being.
The online mental health system being developed by the Young and Well CRC attempts to bring together some key elements to make a real and comprehensive system for use in a number of different health and educational settings. It's got a number of key components. Firstly, really online wellbeing, bringing together all the available systems that we have, apps, websites, other e-health technologies to help manage specific problems. High quality, easily available. Linking those things up with personal records and access. So actually you being able to enter a system, access those particular sets of assisting technologies and start to record information about yourself, track your own well-being and your mental health strengths and difficulties. And thirdly, join up with an e-mental health clinic. Start to be able to move into clinical services in a way online that's as effective, if not better, than what would happen if you actually came to a clinician in a normal, live clinical practice.
While the online mental health system has been designed to be accessible, affordable and available, functionally it has also been designed to be portable and applicable to the many and varied settings in which there is the opportunity to connect with young people. Within each of these settings, the system can be adapted to the specific needs and wants of the populations.
So one of the settings that we're really focused on in working out how to do these systems best is the education system. For younger children, schools, through the secondary school system, and then on into post-school training, universities, TAFEs, workforces for young people. They are some of the most exciting settings in which these new technologies may be effectively applied.
The corporate world is increasingly investing in the well-being of its staff. And they do that because they know that they're going to get greater performance. What we're really interested in is whether they can integrate the system so that they can start to collect real-time data, and we're talking about the use of mobile apps, we're talking about biometric devices, but collect that data in a way that's empowering for the worker and that can be used in an aggregated fashion so that workplaces know when they're doing a good job around supporting the well-being of workers. The way we're thinking of it is that individuals would develop well-being plans that would be supported by the management, the organisation itself, and that they can start to use that information to really shape the approaches that they take to promoting wellbeing in workplaces.
The birth of online technologies has created great new opportunities to connect in appropriate ways with particularly young people living in Aboriginal and Torres Strait Islander communities. So for us in the Young and Well CRC, this is a major challenge and one that we intend to take on with considerable enthusiasm. There are really big issues and they're complex. There's developmental issues, there are social issues, there are alcohol and drug issues, along with the standard mental health issues. But we have found in our experience and in other areas that work in this area that online technologies can really make a difference. So one of the really big issues that online technologies and the system being developed by the Young and Well CRC may really help with is the provision of timely, affordable and accessible services for those who live in rural and remote communities in this very large country. So for the Young and Well CRC, this is really a priority. Let's make a system work that people can connect to throughout this vast land and they get the same degree of specialised assistance as if they were living in one of our major cities.
In developing countries, we have a major challenge, and the challenge is that unlike Australia, they don't have professionals available. There is a huge gap between the number of professionals and the mental health needs of the population groups. What we're looking to do is to create technology solutions which on scale make the provision of support far more achievable in developing countries when you think about the numbers of populations in those countries. Now, if we can get the model right and we can allow that to be integrated into the system of care over in whatever country it might be, the capacity to reach millions of people at really low cost is actually achievable.
Well, it has been calculated that approximately 1,200 psychiatrists are practicing within the country, and 80% of these are located within the major cities and towns. The number of these psychiatrists delivering services to young people with mental health problems is very low. So, this general lack of services combined with the current policy of the Colombian government to extend fiber optic internet access to 96% of the country by the end of 2014 means that an internet-based health system aligned with our current mental health services gives young Colombians the opportunity to take charge on their own health care, where they get to seek the help they want, when they want, and how they want.
Technically, the build of the online mental health system is based on the premise that new and emerging technologies are the most powerful tool for reaching and engaging young people. From a mental health professional and young person's perspective, this predominantly includes online access, social media, and wearable devices that have the capacity to measure physical activity, experiential behaviour, and other biometric markers. From a developer's perspective, this includes innovative web technologies, data mining, pattern recognition, and other smart software solutions.
In mental health, the challenge today is to marry these two perspectives in an innovative and accessible way, which has led to the recent evolution of our online mental health system. This system aims to help us electronically reach young people everywhere, regardless of age, gender, cultural background, and location, as well as the availability of services.